Hello and welcome. This is Lauren Hayden with Live Well with my colleague Chris, and we are here to present to you our information on liver and gallbladder detoxification. Thank you for joining us today. So this presentation is for educational purposes only. We are not medical physicians and do not treat, cure, or claim to cure cancer or any other disease. We suggest that you work with your licensed physician and take our information to them. So my name is Lauren Hayden. I have a master's in holistic nutrition and my practice since 2010. So I've had many certifications and got into alternative medicine because I was very ill and my family was as well. And I was not 100% satisfied with what I was being told about my health. So basically took matters into my own hands. So I'm also an athlete, former tennis pro, and a master level trainer. And most recently, I was certified in functional blood chemistry and clinical homeopathy. And I'm also a master level kinesiologist. So Chris, you want to say something about yourself?
I had just recently graduated from Virginia Tech with my bachelor's in biochemistry, and my background was in research related to enzyme kinetics and basic amino acid transports through proteins. And I currently live with type 1 diabetes, so I'm very involved with my health and nutrition, and my biggest goal and professional goal in life is to really not only help myself, but help others with their health and what other illnesses they may be living with.
So today we're going to be discussing why liver health is so important. It's actually an epidemic in the world today. And we're going to touch on the gallbladder because the gallbladder actually works with the liver to release bile. So we'll talk about the functions of these two important organs of the digestive tract. And then we are going to get into our restoration protocols of how we basically will transform your liver and gallbladder health through diet, nutrition, exercise, and stress management. So this is considered fatty liver. It's a silent epidemic. It's similar to cardiovascular disease in that you don't really know you have a problem until you have a real problem. The first indication might be signs of elevated liver panel, or your cholesterol levels might be elevated as well. So there is both alcoholic and non-alcoholic fatty liver. But what you want to understand is that the healthcare system currently spends over $100 billion annually treating liver disease. And if it's left untreated, you could lose your liver. So what do you want to know about this is that all of this is completely reversible if it's caught early enough. And again, in functional blood chemistry, we will know these markers ahead of time and we'll test to see what is happening, why this individual might not be processing fats properly is usually what happens. And it obviously causes inflammation of the liver and scarring when left untreated, and it could obviously cause, as I mentioned, liver failure. So who's at risk? Any individual who has type 2 diabetes, people with morbid obesity, many children and teens. I see them all the time. We're eating the wrong kinds of fats, and these children are having problems with memory and ADHD and all kinds of things. So these are the warning signs that will come up in your NAQ form, which is your list of symptoms that are not usually related to what your doctors might be asking you. So in functional medicine, we look at the whole body, the whole person, and how all these organ systems are related. So adults aged 40 to 60 is where the peak onset occurs. And you have to remember that your liver is your main detoxifying organ. So when the liver is jammed up with toxins and it isn't able to process properly, this is all going to go back through your blood, and you're going to have numerous different types of symptoms, which we'll talk about soon. So the sad American diet is really the main problem, and then obviously allergies. Liver disease is also implicated in more related to gallbladder and bile, but women who have been on birth control pills, even though it might have been 30, 40 years ago, it interferes with the body's ability to break down fatty acids through vitamin B6. So one of the first things I do with my women is I recommend that they get on a B6 supplement, and through kinesiology and lab testing, you can determine whether or not this is a factor. So liver disease, here's some of the numbers. 25% of US adults are affected, 65% of type 2 diabetics, 95% of morbidity, obese patients have this fatty liver disease, and even our children now are being implicated. So it's a huge problem worldwide, and it's obviously why American is honestly so sick. So what does the liver do? So here it is in the center of your organ system, of the digestive system, and it is our largest, hardest working system. It has over 500 different functions, and this little green area here is your bile. So the bile is the gallbladder, which is released from the liver, and the liver is also very regenerative and restorative. So once we do a thorough detox of the liver, you'll be amazed at how much better you're going to feel, and your liver can get better. Now, there is a point of no return. I have had clients who have had their liver removed, obviously after I was working with them, but we want to do this. So functional medicine is preventive medicine, and this is what we do long before all of these problems occur. So these slides are not made to make you afraid. What we're trying to let you understand is, yes, there is a problem, and yes, we do have a lot of the answers, and yes, there's a lot of preventive things that you can do. So the other massive function of the liver is that it cleanses your blood. So when the liver is not healthy, then all of the toxins that are supposed to be released through the detoxification of the liver process, which we're going to go into in a minute, all of those toxins are then just recirculated back into your blood, not eliminated through the bowels, which is the way it's supposed to do. So here is your detoxification pathways, and I'm going to let Christopher explain this to you.
All right, so how previously Lauren mentioned, the liver is the body's primary detoxification organ. So it's filtering blood coming from the digestive tract and processes hormones, medications, alcohol in particular, metabolic waste products, and any toxins or environmental chemicals. So the liver performs this through two major pathways, which are phase 1 and phase 2 in detoxification. So in phase 1 detoxification, liver enzymes, specifically cytochrome P450, the enzyme system, it chemically modifies these toxins through oxidation and reduction reactions. This helps break down these compounds, but it also can temporarily create reactive intermediates and oxidative stress. So to run these detox enzymes efficiently, the liver heavily depends on nutrients like B vitamins and magnesium, which act as cofactors for many of these reactions. And following this, in phase 2 detoxification, this is where the liver really neutralizes and packages these toxins into water-soluble compounds so that they can safely leave the body through urine, stool, and sweat. This phase really relies heavily on amino acids such as glycine and cysteine. These nutrients help the liver bind toxins through conjugation reactions so they can be excreted efficiently. One of the liver's most important protection systems involves glutathione, which is one of the body's major antioxidants. Glutathione helps neutralize free radicals and binds toxins before they damage any other cell in the body. So it is very important to make sure our body is toxin-free and healthy. And in combination with that, N-acetylcysteine, also known as NAC, helps replenish this glutathione levels and supports the liver's major antioxidant defense.
Excellent. So this is what happens with fatty liver. So basically, a huge problem is this poor little liver due to the sad American diet and consuming all these unhealthy fats, which are not, they have, the hydrogen bonds have basically been broken. So they're not only damaging your liver, they're also damaging a lot of your other healthy cells. So mostly what we're talking about is also non-alcoholic fatty liver. So again, it's going to interfere with the detoxification process, which we just discussed. And as I mentioned, these toxins will then recirculate back into the blood, into your cells, making you feel horrible, actually. And you wonder, why do I not feel well? Why is my glucose levels too low? Why is my doctor telling me I have insulin resistance? Well, maybe the problem is in the liver. So this is one of the first areas that we look at. So it also suppresses your immune system because when your body is not digesting and absorbing properly, and these toxins are basically recirculating, then your immune system's job is like overwhelmed. And this can lead to individuals with allergies. So I was with a girlfriend of mine on the tennis team today, and massive allergies. And I wonder, hey, could this be related to our liver health? And obviously also for cancer cells are not detoxified properly as well. And this can lead to metastasis. And this is Dr. Cabot, 2015. So she's a physician. We call her the liver doctor. She's just amazing. So again, fatty liver disease is a silent thing, just like cardiovascular disease. So we don't really know. It kind of creeps up to you, and with very few symptoms until all of a sudden we can go into liver failure. So what are the symptoms of liver dysfunction? So fatigue, abdominal bloating, gas, just feelings of malaise or indigestion, the accumulation of fat around your belly area. So a lot of my clients come in and I'm like, there's a lot of fat accumulated here. And then we look at their cholesterol levels, etc. I do some kinesiology testing. We look at the labs and we realize, hey, your abdominal fat is not being properly utilized, which I'll get into in a minute. So headaches, migraines. So you can imagine, as these toxins recirculate, and in Chinese medicine, the gallbladder runs through deep sleep point. So my clients are having trouble sleeping as well, headaches, vomiting, nausea. So with an inability to lose weight. So no matter what I do, Lauren, I can't lose weight. Okay, so let's get your liver cleansed and have your fats being metabolized properly, and great things can happen. So obviously we'll get into that all in a minute in our treatment plans. So you'll see that your cholesterol and triglyceride levels are elevated, and you might have pain in the right quadrant underneath your breast. That's where your liver is. Acid reflux, hemorrhoids, fatty skin deposits in your skin, gallstones, and also gallbladder attacks. So one of the clients came to me after having a huge gallbladder attack following a vacation where they ate a lot of delicious Maine lobster and literally wound up in the ER. So also it will elevate your blood pressure and obviously can create depression and poor memory. So here's some of the blood chem panels that we look at. And again, we are going to be having a full webinar on functional blood chemistry assessment related to this in the next 2 weeks. So we hope you have time to look at that. And again, these are for educational purposes. And we believe that an educated client is then empowered to take control of their own health. So Chris, do you want to talk a little bit about the functional blood chemistry markers for us?
Yeah, of course. So there are several blood biomarkers that help assess liver stress and metabolic dysfunction. And we'll be looking at this table for some that help us identify what might be going on in correlations to our liver and our gallbladder. So AST and ALT, these are liver enzymes that become elevated when liver cells are damaged or inflamed. So this is very important to look at and make sure, are we seeing any dysfunction or attack on the liver, or the liver struggling within the body? And then we have our GGT, which is gamma glutamyl transferase. So it's also another enzyme often elevated in fatty liver disease or alcohol-related liver stress, as well as bile duct dysfunction. ALP, also known as alkaline phosphatase, can become elevated when bile flow is impaired or when gallbladder obstruction is present. And then bilirubin is a breakdown product of red blood cells, and elevated levels of this typically suggest impaired bile flow or liver dysfunction. Albumin is also a protein made by the liver, and typically when we have patients that we look at in their blood markers and they have a low albumin level, this most likely potentially indicates reduced liver synthetic function. Ferritin also it helps us store iron, is often elevated in fatty liver disease and chronic inflammation. So these are very important markers to look at. Triglycerides are another very important marker because elevated blood fats are strongly associated with fatty liver and metabolic syndrome. And then last but not least, elevated fasting glucose or hemoglobin A1C can indicate insulin resistance. So which is strong, it considers one of the major drivers of fatty liver progression and liver inflammation. So when we do a blood marker analysis of anyone and these values are, I guess, very high, we have a strong indication that it might be tied to any liver stress or dysfunction, and we try to tackle that as fast as possible.
Okay, so now let's talk about liver detoxification. So what do we do about this? Well, the first thing we do is we look at these blood chem markers and we look at your symptoms and your history. And obviously I can do a kinesiology exam, which will indicate the health of the organ system. And we can't tell you how much this happens and that the liver can, again, heal itself when it's detoxified properly. So what you're going to notice through a liver detoxification through Live Well is increased energy, mental clarity. You might notice that your blood pressure goes down and your cholesterol levels start to improve. And again, please realize this is not a quick fix like traditional medicine. It is not a magic pill or a magic bullet. This takes time. You have to be patient and realize that this has been accumulating for years and years. So once we clean your blood and your lymph and your liver starts functioning and eliminating, you just obviously have a stronger immune system, and your immune system is now able to fight. You might notice that you don't have as many allergies. You'll see improvements in your sleep, in your mood. If your children have anxiety and nervousness, these types of symptoms go away. They start doing better in school. Sounds too good to be true, right? But when we cleanse the body, great things happen. So think of the liver like your car. If you don't clean the engine, take out the carburetor and clean the plugs and put in new clean oil. This is basically what we're doing, is we're basically cleansing your body for you naturally without drugs and surgery. So you will naturally start to lose weight as your fat metabolism improves and your body is using these healthy fats. So fat is essential, but it's needed for energy, not to be stored in your fat cells, making you very sick. And that's why your triglyceride levels are so elevated, because it's basically going in the opposite direction and sending the fat back to the liver to be processed, which is crazy and causes oxidation and all kinds of problems. So once you also do our liver gallbladder flush, it can also remove small gallstones. And obviously it's going to reduce your risk of cancer. So how do we do this? So what are the first dietary things you want to realize? What do we need to avoid? Everyone's individual. There's no cookie cutter answer for this, but typically we want to make sure that you're consuming less refined grains, eliminating white flour, which the bugs don't even eat. It's highly toxic. So you need to eliminate it from your diet, and it doesn't have so much to do with gluten, but we also suggest gluten as well, because most of the gluten in the US, our beautiful wheat, is all sprayed with glyphosates. So processed vegetable fats are a real problem. Heating in a pan These vegetable fats are not high heat, and once they are oxidized, they basically become free radicals. And not only are they going to mess up your liver, but you have to realize that these fats are need to make all of your healthy hormones, your thyroid hormones and your sex hormones. So these are all problems that occur when we don't have a healthy functioning liver. So eliminating, of course, the evil high fructose corn syrup, getting rid of the Diet Cokes and the contaminants that are in those diet sodas. And again, this is a process that we do over time. I don't expect you to eliminate everything at once. So I usually give you 30 days to, change, make small little changes. And it's really not a big deal over time. I was even able to stop drinking wine, which was a big stressor for me. So I do consume a little bit of alcohol, but it's grain-free vodka occasionally, but I actually prefer CBD. It's much healthier for me. So that's one of the things that I would replace the alcohol with for a lot of my clients. And so one of the things we need to increase would be your raw and lightly cooked vegetables, al dente, so you can saute them lightly in some sunflower oil, or high heat avocado oil is usually good. But the best thing to do is honestly to steam your vegetables, and then you can add the healthy oils on later. And then dietary wise, EPA, DHA oil is very high in fish. So consuming lots of healthy fish, which is hard to find on the planet these days, but it's out there. And I don't recommend farm-raised fish for a lot of reasons, but some are better than others. And we have an incredible product from Premier Research Labs. It's called Deltanol, and it prevents oxidative stress to your cells. And as I mentioned, the sunflower oils and the avocado oils. So berries and citrus are awesome. And then fiber. So your legumes and your beans, ladies and gentlemen, eat lots of healthy legumes. They are so good for you, and they're very powerful antioxidants. And then, of course, getting enough vitamin D and making sure your physician is running your vitamin D panels, please, because inadequate D is also implicated in liver degeneration. So I'm not going to get too much into the relationship between the thyroid and the gluten, but I will say that T3 and T4, the conversion process is important, and the gluten connection does, as I mentioned, eliminating white flour is really important. So juicing, this is your liver doctor again, Dr. Cabot, www.liverdoctor. She's amazing, and juicing is really powerful to help cleanse the liver during this process. And you'll feel so much better as we do a juice cleanse. I also make dietary adjustment changes as well. So let's talk a little bit about the gallbladder. And in Chinese medicine, it's considered the decision organ. And remember, it stores bile. So it's basically the little sac that they stores this bile, which is the release of the toxins from the liver, which you'll see in a slide in a minute. But basically, a healthy gallbladder is essential for healthy fats. And once they remove that gallbladder, ladies and gentlemen, now your liver has just taken over the function. So your problem is still there, and you are still going to have issues with your liver. I hate to say it, but it's true. So again, the functions of the bile are to emulsify these fats so that your organ systems can use them, as I mentioned earlier, and your cells and your brain cells and your nerve cells are all lined in these healthy fats. So healthy fats are essential. It's just that you're not digesting and absorbing them properly. So that's what we do at Live Well, and we make sure that the fats are metabolized and going directly into your blood until we can fix your liver. So again, it carries these toxins out through bilirubin and also absorbs fat-soluble vitamins A, D, E, and K. So all of this will help prevent the crystallization and development of gallstones. And so this is obviously an advanced case of cholecystitis, and this gallbladder here needs to be removed because it's now so toxic. And all this can be prevented. So cholecystitis and gallbladder disease, I'm not going to get into this too far, but it's all preventable, ladies and gentlemen. So here's how we do it. So what is the way? So obviously we go through these advanced tests. And one of the things, once we do a liver and gallbladder detox, is I recommend all my clients do coffee enemas. And mostly this is what Dr. Mayo of the Mayo Clinic back in 1896, who was famous for. And why does the medical system no longer recognize coffee enemas? We don't know, but we still use them in natural medicine, and they increase the body's glutathione production. Remember, Chris talked about how important glutathione is, and it basically strips also the fecal matter off of your large intestine. So I can't tell you how many incredible benefits there are to doing coffee enemas. And once you get used to it, it's really not a big deal. So here you go. Any institution that you go to, functional medicine-wise in the world, Hippocrates or Germany, or if you go to San Aviv in Mexico, they're going to do a series of coffee enemas. And so what are the systemic benefits? They remove these toxins, parasites, bacteria, reduce pain and symptoms of chronic toxicity, improves your digestion, less confusion, less nervousness. And as I mentioned earlier, it's like mechanically, these coffee enemas will mechanically cleanse your colon and strip it of diverticulitis and all kinds of things. You'll be so squeaky clean. You'll not have to worry about the leading cause of cancer, which is a toxic colon, once you do a coffee enema. And then I also do a liver gallbladder flush after that. So I continue to do coffee enemas throughout the year at certain times of the year. And we also recommend an infrared heating pad that you can put over your liver in the evening during this process. So here's our liver gallbladder bundle. You can go to Desbio. There's a link that you would have received and purchase these incredible products. And this is our first step of preparing you for a healthy liver function. And all of these are discounted to you as members of my Live Well network. And you'll receive a coupon code. I'm not going to get too much into what these wonderful products do, but we talk about them so much. So I don't want to take too much of your time today. You will receive the information on this again from me, so you can look further into these products. But all of the products I use are by Premier Research Labs or Desbio. And these are all live source FDA regulated facilities that you can only get by a licensed professional. So we need to make sure that you're using them properly. And as you can see here, we have glutathione, which is the body's master detoxification and antioxidant, and it comes in a liposomal delivery system. So you don't have to go for intravenous injections of any of this. We can do this all through liposomals. And it's also helpful for removing heavy metals as well. And here is a code for you, ladies and gentlemen, for our Mother's Day special. We thank you for being with us today, and we are giving you 10% off our initial consult. Chris and I will perform the consult with you, and we look forward to helping you restore your liver and gallbladder. And thank you so much for joining us today.